Hi, my name is Meg. I'm a student in advanced self-assessment. I'll be performing this head-to-toe assessment on Jim. Jim, do you give me permission to record and perform this assessment?
Yes.
Okay. So the first thing I'm going to do, I've already washed my hands, so I'm going to introduce myself to the patient, and I'm going to start with the head assessment. So basically at this point, I'm going to be assessing his skin throughout this exam for any abnormal lesions or discoloration, moles. I'm going to start literally at the scalp. So I'm assessing for any ulcerations, lesions, any dandruff, anything unusual on the scalp, and there's none seen here. I'm now going to inspect his face. So I'm looking at the symmetry of the face, the characteristics, noting any asymmetry, trauma to the face. I'm now going to palpate his the temporal and maxillary sinuses. Any pain when I do that, Jim?
No.
Okay. So now I'm going to palpate his lymph nodes. So go right in here. Any pain when I do that?
Mm-mm.
How about in there?
No.
Okay. So now I'm going to inspect his nose. So I am going to just gonna look up there for any inflammation. It is a little bit inflamed just because he has allergies. I'm also observing for any misalignment of the nose. And you want to make sure that both nostrils are patent. So I'm going to have you, are you able to breathe in comfortably when I do that? He's a little congested, so that's kind of uncomfortable. How about there? Okay. So that's uncomfortable for him because the nostrils aren't patent, but you would assess that in each patient. Moving on, I'm going to assess his ears. So I'm basically assessing the alignment of the ears, the symmetry of the ears, making sure that there's no drainage. Have you had any ear pain? I would ask the patient. Now I'm going to just be palpating. Can you look over there? So any pain when I do that?
No.
There?
Nope.
Back here?
Nope.
Okay. So now I'm going to go ahead and I am going to take my tuning fork and I'm going to do the Weber test. And you feel that vibration equally on both sides?
I do.
Okay. So now I'm going to do the Renee test. Do you feel the vibration?
I do.
And then you bring it forward. Is it equal?
Yes.
Okay. So now I'm going to go ahead and I am going to insert the speculum into the ear for his ear exam. So you're going to go up and back in an adult and we'll insert it, assessing for any wax, any bulging of the ear, or opacities. They look clear. And now I am going to do his eye exam. So moving on to his eye exam, the first thing I'm going to do is I'm going to look into his eyes and make sure that the sclera looks normal. I'm making sure that there's no jaundice, that there's no redness, discharge, discoloration. I'm going to ask him if he has any concerns with his eyes.
Nope.
No? Okay. So now after I do that, I am going to have him read the smallest line on the chart, blocking one of his eyes.
CFDHJ.
Perfect. So after doing that, I'm going to take a look into his eyes with the ophthalmoscope. I'm also going to check his, to make sure his pupils are equal. I'm going to check his gaze, so I'm going to have you look from left to right. Sorry, it's a little bright. Up and down. So now I'm going to finally turn the light off, and I'm going to check his eyes with the ophthalmoscope and check his accommodation to light in the pupils. So imagining that we're in an actual exam room and that this is a completely dark room, I'm just going to do it like that. And I'm just going to take a quick peek into his eyes. Good. And his eyes are accommodating to light. I'm going to go ahead and turn the light back on.
No, that one's off. Sorry. It's okay.
And one thing before we move on, I'm going to do the whispered voice test on his, back to his ear one more time. And you're going to repeat the 3 words I'm saying.
Mickey, Minnie, Donald.
Disney on the brain. So then for the final eye piece, I'm going to have you take so this is going to be his accommodation to light, and I'm going to have you
Screen.
block one eye. Tell me how many fingers I'm holding up.
1, 2, 5.
Okay. So now those were all normal. I'm going to now finally move on to his mouth and pharynx assessment. I'm going to have you open your mouth, his jaw. Now I'm going to take a look in his mouth. And I'm going to have you say, ah. Okay. I'm going to have you stick out your tongue. Okay. Now, normally in a normal patient, I would stick this in and kind of check to make sure that assessing his tonsils, the pillars, the pharynx, making sure that there's no redness, ulcerations, exudate. Jim has a really bad gag reflex, so I'm not going to do that today. But in a normal patient, I would. And I would be assessing for any hypertrophy, any tonsillar stones. We're not going to do that today. But again, I did take a look at his tonsils. Maybe stick your tongue out a little bit more. Good. Now, I'm also going to have you puff out your cheeks. Perfect. Can you smile? Can you stick out your tongue? Good. Can you scrunch your eyebrows? Cheeks? Yep. Perfect. Okay. Perfect. So moving down, I am going to now start assessing his upper extremities. Perfect. He's done this before. I'm going to have you move them up and down like that. Good. Any pain when you do that?
No.
Okay. And you're able to do that.
Mm-hmm.
You're able to go away.
Mm-hmm.
Good. Now, with your shoulder, I'm going to have you raise it up. Okay. Can you do it up and away? Good. Can you go on the other side, like you're scratching the other side of your shoulder? Good. And can you go all the way in? Good. All right. So that would be his full range of motion of his shoulders. I'm going to also have you, going to have you move your arm, like those out. Good. And keep inward with your hands. So that's just assessing his wrists. And now I am going to just, while I'm here, I'm going to get his radial pulse. And I'm also going to get his brachial pulse using the pads of my fingers. While I'm doing this, I'm just assessing his skin characteristics, again, for any lesions or any abnormalities. None are noted. I'm going to move on to his chest. I'm going to have you turn to that side. Good. So first I'm going to check for, I'm just inspecting here. I'm also going to, just for any deviations, abnormal asymmetry, and I am now going to just kind of feel here. I'm going to palpate the chest.
The back.
The posterior chest. Anterior chest, I'm sorry. Okay, so now I'm going to have you say 99.
99, 99, 99, 99, 99.
Good. Okay. So now I'm going to percuss for any hyperresonance. Moving downward and laterally. So I'm going to make sure that there's no cross-vertebral angle tenderness. Any pain when I did that?
Nope.
There?
Nope.
Okay. Now I'm going to auscultate his lungs. Take a deep breath in for me, Jim. Good. Okay. All right. So now I'm going to move on to the front. I'm noting his posture. I'm going to be noting for any pulsations or heaves. And now I'm looking at for any increased work of breathing, wheezing, shortness of breath. I'm looking at his coloring. I'm making sure that there's no blue cyanosis. I'm making sure that there's no clubbing of his fingers, that there's swift capillary refill. And there is. Any pain when I'm pressing?
No.
Just kind of palpating here. I'm palpating the chest. Now I'm going to percuss. I'm going to have Jim lay down.
Sorry. That's okay.
So the first thing I'm going to do is I am going to percuss his chest. I'm going to do it the midline. I'm going to percuss for his liver. Spleen. All right, you can come back up. I'm going to listen to his heart sounds here. The aortic, pulmonic, tricuspid, Erb's point, and the mitral valve. also going to palpate the apical pulse, which is the 5th intercostal midclavicular line. Okay, perfect. So now I'm going to move on to his abdominal assessment. So what I'm actually going to do is I'm going to have you lay down again. Sorry.
Don't be sorry.
Okay. So I'm inspecting his abdomen. The abdominal assessment is unique in the sense that you're going to auscultate bowel sounds first because palpating and percussion can alter the bowel sounds. So I'm going to start. I'm also noting any asymmetry for any potential hernia or deviation in the abdomen, which none is seen here. His abdomen looks normal. You're going to want to hear like normal is 4 to 36 bowel sounds per minute. Anything more or less than that is an abnormal finding. I'm going to now push on the abdomen. Any pain when I'm pushing?
Nope.
And I am going to be percussing for any hyperresonance. So now I'm going to move on. His abdominal exam is pretty normal here. There's no hyperactive vowel sounds. There's no pain when I'm pushing. Everything looks pretty normal. I'm going to move on to his lower extremities. So Jim, I'm going to have you come back up. So, I'm also going to, I should have said this before, I assessed the glands down there, as well for any swelling or tenderness, which there wasn't any. So now I'm going to have you, can you flex out your leg? Push up? Perfect. So you're going to want to support any patient. I think you can see that. Perfect. Okay. And now come back in. Good. And now I'm going to have you
Screen.
Okay. Sorry.
It's okay.
Okay. So now I'm going to have you, with your ankles, I'm going to have you dorsiflex. No, I'm going to have you point them. Go forward. And now can you do it against resistance? Okay. Now I'm going to have you, can you push out your toes? So I'm just checking, the range of motion of his ankles. So I'm going to have you, can you go like that? And can you put it inward? Perfect. And perfect. And you do it on both sides. I'm going to have you lay down. Just see how we're doing on time. Okay, 19. Okay. So I'm going to have you bend your legs. And can you go outward, like away? Good. Good. Okay. Put them out again, like flat. Can you go away from? Perfect. Okay. And then I'm going to have you do it again. Perfect. Okay. So, he has full range of motion of those areas. I'm now going to move on to the final section, which is the neuro assessment. I'm going to have you sit up. Okay. So neurologically, you're kind of assessing their mental status. So, making sure that they're oriented, do you know where you are? Who, like,
Yes.
person, time, place. That's part of the mental status exam. And it's all relevant to the neurological exam. And then I'm going to have you close your eyes. Can you tell me what you smell?
Cinnamon?
Yes. Okay. So, good. So we're going to do a couple tests here. I'm going to have you close your eyes. Can you feel that? Sorry.
Yes,
You
I can.
definitely felt that. Can you feel that?
Mm-hmm. Mm-hmm.
Okay. So now I'm going to check his pain sensation usually use a paper clip. I'm using a bobby pin that's split in half. And you're going to tell me if you feel...
Eyes closed?
Yes, sorry. He's going to tell me if he feels it on both points or one point. This kind of checks his sensation.
I feel it.
Do you feel 2 or 1 point?
Right now, 1. 2. 2, I want to say. 1.
Yeah.
1. 2.
Good. So pain sensation is normal. I'm going to have you close your eyes again. Put this. I'm going to put something in your hand, and I want you to identify what it is.
Pen.
Yeah, and that just makes sure that he can. I can't pronounce the word striganosis. I can't say it. Okay, so I don't know if that matters, but okay. So now I'm going to have you stand up. I'm going to have. Okay. Sorry. So I'm going to have you walk heel to toe for me. I know it's kind of goofy. Good. Can you walk just on your heels? Kind of. I'm just kidding. And can you just walk normally for me? Good. Good. So I assessed his gait. It's normal. I'm going to check his reflexes. Tricep reflex. Right below the knee. Going?
All right, you're good.
It's kind of funny. Okay, so now for the neuro assessment, I'm also going to check your feel that?
Mm-hmm. Mm-hmm.
Okay.
Mm-hmm.
All right. And then with the neuro assessment, the cranial nerves, which were tested before, which are sense of smell, puffing out the cheeks, furrowing the brows, smiling, tongue, that was all assessed earlier in the video. I'm going to go ahead and move on and take a look at his spine neurologically. So I'm going to have you stand up for me. Okay. Now I'm going to have you move forward. Like kind of bend over like you're doing a scoliosis test. And the back is straight and symmetrical. You can come back up. You also, the shoulders, one sign of scoliosis would be one is higher than the other. I'm going to have you sit down really quick. Sorry. I'm going to have you also move your shoulders to resistance. Okay, good. Such a brat. Okay. And now I'm going to have you do a couple ranges of motion with your spine or your back, if you don't mind standing up one more time for me. So I'm going to have you kind of extend backward. Don't fall over. I'm going to have you go to the side. Okay. And I'm going to have you extend forward again. Just make sure you have full range of motion, which he does, obviously. You can sit back down. And this would be considered a normal neurological assessment. Jim was kind enough to participate in. Everything was normal. Any abnormal findings, I would, obviously, in terms of the neurological assessment, I would have to further examine in terms of the reflexes. One thing is if the reflexes were not equal on both sides, that's pretty concerning, and you'd want to look further into it, but everything here was normal and symmetrical, and that's how I would update the chart, and that is the end of my neuro exam and the head-to-toe assessment. Thank you.